Back once again with Taylor Bradford of the Gloucester Daily Times to give us the latest on all things happening in and around Cape Ann. How you doing, Taylor?
I'm doing well. How are you guys doing?
Great. Okay, right up the top, we have some big news from City Hall in Gloucester again.
Yeah, so Tuesday there's an announcement that after a little over 3 months as acting as the Gloucester's Chief Administrative Officer, Nicole Keyser will be leaving her role as of May 7th. So this was notified in an email that she sent to city councilors, city managers, and the mayor on Tuesday. And she noted in that email that she will not seek confirmation by the city council. Now, in that email, she had stated that her reasoning for leaving is personal, and I tried to follow up with her, the mayor, and her assistant, Christopher Ronza. None of them answered to email or phone calls, but in the email, so we couldn't specify what that personal reason might have been. But in the email, she also noted that she understands that the lack of specifics can lead to rumors and misinformation. She wanted to be clear that she's committed to the mayor, and that she has respect and admiration for her, remain steadfast through all of this, and that she considers her a remarkable woman. Now, in this email, she also noted that people will begin to hear this news that she'll be leaving, and she's certain that there might be kind of chatter about how maybe she wasn't qualified or maybe she was overwhelmed. But in that email, she also specified that neither of those things are true, and that she has confidence in her skills and her experience and believe that she would have been able to have a very successful time here. Again, the reasoning for her leaving was unknown and is currently unknown. Now, Keyser was appointed by the mayor on January 26th after interim Vanessa Krosick resigned from her position. The details of why Vanessa resigned are pretty muddled right now. We're not quite sure the specifics on that either. But prior to Vanessa, we had Jim Destino. Jim Destino has been with the city for quite a while. You know, he was CAO for a long time. He came in, he came out. He was planning to retire. The pandemic hit. He stayed on for a little bit while longer, then he retired. That's when Vanessa came on. And so that's 3 CAOs in a matter of 10 months, which is quite astonishing to say the least, to have somebody in that important of a position kind of leave 3 times. One was expected. We knew that Jim Destino was going to be retiring, but the other 2 were quite unexpected, especially for Nicole, who's only here for a little bit over 3 months. But kind of going forward, she noted in the email that the mayor supports her decision to kind of step down from her position, and they're working together to find a replacement. That's all that we have now, as we're still awaiting comment from anybody within the mayor's office. But the story will be developing as we find out more.
Right. And obviously, so there's no timetable for when they would prefer to have a replacement in that position again.
Correct.
Okay. All right, and Taylor, the other big news is we've seen a slight spike in COVID cases at Seacoast.
Yeah, so Seacoast Skilled Nursing Home and Rehabilitation, which is a 146-bed facility over at 292 Washington Street, has had 8 reported cases of the novel coronavirus among their staff and residents in the past 14 days. Now, this data comes from the state's Department of Public Health's COVID-19 dashboard that kind of goes through all the long-term facility cases in the Commonwealth and kind of notes their current COVID cases, their death toll, kind of all the different things that would be important to note and archive as they continue to see the data throughout the pandemic. Now, this information was collected as of April 12th, and I reached out to them to kind of touch base and see where are they now. Obviously, this data is about a week old, so where are they now that these numbers have been reported? And representatives from Seacoast had noted that 2 of the 3 patients, 3 patients were briefly hospitalized, but none are remaining in the hospital, which is great news. And the positive cases were identified by frequent surveillance testing that they do. And so Emily Segru of Bain Care Management that kind of runs Seacoast had mentioned that while not everyone has chosen to receive the vaccine, they continue to provide education and opportunities for those individuals to do so. And so that statement right there answered a really important question that I had was, I thought that everyone within nursing homes and long-term care facilities had been vaccinated a long time ago. So when their cases of COVID be close to 0. And, when she noted that, people can choose if they want to get a vaccine, it's not mandatory. Then, those who maybe didn't get the vaccine were a little bit more inclined to potentially get COVID or maybe those who did get the vaccine also got COVID. And that part we don't have answers on. But I thought that was an interesting note, the fact that, even though they were the first in line to get the vaccine, it doesn't necessarily mean that everyone there did get it. And it shows that everyone, even whether you have the vaccine or not, there's still a potential of getting the virus. And again, that's something that I think we're constantly learning here, both in the city, the state, and the country, and the world, is how do we respond to the virus? And once we have the vaccine, how can we go about, and is it still safe to go about doing our daily life like it was before the pandemic? And I think this is a great example of, we're still in a pandemic. And so they noted that when they did find out about these cases, they took those members of their community who tested positive and brought them into very specific COVID rooms, and kind of from there planned out the mitigation of how they were to go about, making sure that the virus didn't spread anymore. And they're continuing to kind of keep tabs on everything that's going on and trying to mitigate the spread as much as possible.
Well done.
No instances in any of the other senior care facilities on Cape Ann, right, Taylor? Correct. Currently, according to that data sheet, I looked at the others, such as Gloucester Healthcare and Denmark, and both of them did not have any current cases. However, it was notable that those long-term care facilities have had COVID-related deaths over the span of the pandemic, while Seacoast has had 0, which is just an interesting data point to know. But yeah, as of right now, none of them have any cases.
Any other big stories you're following up on, Taylor?
So people should stay tuned and go to our website to check in the latest on 2 different stories. The first is one that we've talked about before here on 1623, and that's in regards to the Health Board of Health's drafting of a letter that distinguishes the health department's role from other city entities. And that comes as Karen Carroll, the city's public health director, had noted 6 different concerns that she had for ways in which the mayor's office, and particularly the mayor, had involved themselves within the department's plan to mitigate the spread of COVID-19. And so that letter has been drafted and is continuing to be drafted on Thursday night's meeting. And so you can find the latest on our website at gloucestertimes.com. And another one to note, I know that you guys spoke with Patty Page earlier about mosquitoes, and the city is looking to opt out of a state program that would kind of take over the mosquito mitigation plan. And as of right now, Gloucester is a no spray zone, no spraying pesticides, and no aerial or truck spray of any kind. And I spoke with Max Schneck over at the Board of Health, and he had mentioned that as of right now, the city and the Board of Health look to promote personal protection, education, and awareness are the best defenses against the diseases caused by mosquitoes and ticks. And that's kind of what their mantra is as of right now, as they opt out of that program. But again, as of May, when it comes to May 15th, the state will not allow cities and towns to opt out of the program unless they've done the proper paperwork. So the city is doing all that paperwork now to try to opt out of the program, as is Rockport, or to start that conversation of what that might look like, so that they too can opt out. Now the question, I'm sure Patty Page noted this as she works for as a part of a lobster company, is why opt out? Why opt out of a program that allows the state to kind of take over that responsibility for you? And she noted that for the perspective of a lot of people, that the pesticides being sprayed is not only will not only kill mosquitoes, but is also harmful to people and lobsters. And here in Gloucester, we are a huge lobster community. And so I think people raised their concerns quite loudly and noted that this is something that they don't want the state controlling because of the specifics of here in Gloucester, and what the community here focuses on, both from an economic standpoint and a livelihood standpoint. And we're not alone. Rockport, I spoke with Alan McMillan of the Conservation Commission yesterday while he was walking a trail, and he had noted, he is in agreement with Patty that this is something that we need to be on top of, and that he wishes it was an opt-in program rather than an opt-out program, because to opt out of something, then it could just pass you by without realizing it. But an opt-in program is much more an active approach to engaging within both local and state governance, and how we can make those active decisions. And so, especially, he also noted that I thought it was an interesting fact that the Rockport Board of Health and Selectmen didn't know about the deadline of May 15th until Patty Page told him, and then he told everybody else. So it shows, one, the community working together to raise awareness of something, but two, it also shows, that question of opt-in and opt-out programs that the state provides. And obviously the state is working hard to provide a service, but the question is whether or not it's helpful to the specific municipalities such as Gloucester and Rockport.
Yeah, Patty Page emphasized that to us, that the governor made this decision last summer when people were distracted, and he was worried about equine encephalitis and what's the other one that people
West Nile virus.
West Nile virus, yes, and no one else was worried about that. And then this crept up on them, on all these communities, and there was very little communication from the state saying, "Hello, it's time to opt out if you want to." And there's a pretty rigorous process. You have to come up with a plan as a community and present that to the state, and it has to be passed. So it's not just like checking a box to opt out. And you have to have a public hearing, and the community has to be involved.
Right. So both of those two communities are going to be doing that whole process and having those discussions to try to figure out if it's the best thing to opt out. Which you're right, Heather. It's such an interesting city and state politics, I think, is some of the most fascinating stuff. And this one is one just great example of that, of how it continues to ebb and flow, whether there's a pandemic or not. Crazy to think about 2 years ago, Triple E was the most terrifying thing on our radar. And now where we are.
Yeah, it's just like a passing fancy. But
lots of interesting news this week, Taylor. We thank you for your time. Have a great weekend, and we'll be sure to tune into the Times in the meantime.
All right, guys, have a great week.
Thanks, Taylor.